This is an illustration of what happens to the CXA or clivoaxial angle and stretch on the spinal cord in some patients who have pathology and craniocervical instability. So this is the skull, this is the spinal cord, that's the medulla. CXA is 150 here, and the patient's in neutral, and this is the stretch on the central nervous system, which is 0. So as we get to a CXA of 140 and some flexion of the head on the neck, there's normal stretch on the spinal cord and medulla. As we get to more flexion of the head on the neck and a CXA of 130, still normal stretch on the spinal cord and medulla. But then as we get to 120, we see maximum flexion of the head on the neck and pathologic stretch on the spinal cord and medulla. So if we just look at that again and animate it, it would look like this. Thanks so much for watching and have a great day.